I would now like to move to Dr. Arsen Thorosyan. You are the Minister of Health in Armenia. And Minister, can you tell us a little bit more about your specific health priorities when implementing the SDGs? I know particularly that you are doing some important work both on the elements of financing and primary health care. The floor is yours.
Thank you. Is this on? Okay. So the government of Armenia is fully committed to the attainment of UN Agenda of 2030 and signed on to agenda on its 17th SDGs in September 2015. In 2017, the government started with the nationalization process, the integration of SDGs into the national strategic framework and the establishment of the system of reporting and assessing progress. In mid-2017, Armenia initiated the development of new Armenia Development Strategy 2030. So health and well-being are high on the agenda, and we can show progress on several of them. So infant and under 5 mortality rates are reducing, but maternal mortality is higher than EU averages. 91% of the target population are now covered by all vaccines included in our national vaccination program. All registered people with advanced HIV infection have now access to antiretroviral medicines, and in 2017, Armenia became one of the first 4 countries in the world to eliminate mother-to-child transmission of HIV. The number of tuberculosis cases has been steadily decreasing in the last decade and was 27 people per 100,000 population in 2017. The country developed a national strategy to reduce morbidity and mortality due to chronic hepatitis B and C. However, development and implementation of effective viral hepatitis control measures remains a major issue for the healthcare system. The mortality burden due to most relevant prevalent NCDs comprised 80%, with CVD being the lead cause, 48%, followed by cancer, 21%, diabetes, 4%, injuries, poisoning and external causes, 4.5%. Chronic obstructive pulmonary diseases, including bronchitis, asthma, and other chronic pulmonary and bronchoectasis diseases, 4%. Risk factors contribute to the rise of NCDs. For example, the level of tobacco use is high among male population in Armenia, with more than 52% of men and 1.2% of women smoking tobacco. Armenia has ratified WHO FCTC, however, many interventions are still not enforced. Now we are working on the draft new tobacco law, which will enlarge the scope of restrictions on smoking areas in Armenia. Our priorities with the SDGs are clear. We need to focus on strengthening prevention of diseases through early diagnosis and treatment with special emphasis on non-communicable diseases. A strong primary healthcare system needs to be in place, including increased accessibility to deprived populations, guaranteed availability of medicines and technologies, and the provision of long-term patient-centered care. Develop and implement better standards in healthcare services, ensuring specialized inpatient medical care for vulnerable groups, improved maternal and child care, reproductive and adolescent health. Next priority is medical providers' capacity building and professional development, and introduction of health insurance to enhance the financial sustainability of the overall healthcare system in the country. But all this, we cannot do this alone. We require cooperation across sectors, including for allocation of resources and ensure their efficient use at the service delivery level. Government taxation and revenue collection, sound planning and financial management, anti-corruption measures, and universal social protection. And let me conclude here that I think very much of the WHO support and the SDG roadmap in particular highlights the need for strengthened primary care, continuous, comprehensive, coordinated, community-oriented, people-centered, safe, timely, effective, and efficient primary care system combined with financial protection by universal coverage seems to be the gold pathway to reach the Sustainable Development Goals and health for all. Thank you.
Thank you very much, Dr. Thorosyan. I particularly liked your emphasis on prevention and universal health coverage. And I would like now to invite Dr.